and welcome to the second in a series of webinars on health systems performance assessment. Today, we'll be talking about participatory governance and its impact on health systems performance. More specifically, we'll be looking at, can we measure participation? Can we measure participatory governance? We know that the governance function is one of the most complex in the health system. And more importantly, can we link participation and participatory activity to health systems performance dimensions, such as access, quality, equity, efficiency, financial protection, of course, overall health improvement of the population, and not to forget responsiveness or people-centeredness. We'll kickstart this webinar with a poll to see what you think about some of these performance dimensions. So I'll hand over to Erica to launch the poll. Over to you, Erica.
Hello, everyone. Just a little poll as a warm up for us all. We'd be really interested to find out which aspects of performance are priorities in your country. So is it quality? Is it access? Is it efficiency? Is it equity? Is it about improving health outcomes? Is it about people-centeredness or responsiveness or financial protection, or indeed none of the above? So really interested to hear what's going on in your country. Please do let us know. Thank you very much. Back to you in the studio, Deepa.
Okay, so while you are all answering those poll questions, we'll get the results later. We'll first go into our keynote presentation, which will be done by my dear colleague Kira Koch from WHO headquarters, whom I've had the pleasure to have worked with for many years now. Kira is in the Systems Governance and Stewardship Unit in the Primary Healthcare Special Program at WHO headquarters in Geneva. She is co-editor of the WHO Handbook on Social Participation for Universal Health Coverage, a guidance document for policymakers and how to more effectively and meaningfully engage with people, communities, and civil society. She also works on health systems performance assessment and co-authored several chapters in our recently released health systems performance assessment book. So we'll be hearing today about participation indicators. How do countries measure participation? What kind of indicators are out there, and how can we link that to system performance? Over to you, Kira.
Thank you very much, Deepa, and welcome everyone from my side as well. It's a real pleasure to be here with you and take part in the second webinar of the HSPA series. And today, as Deepa just mentioned, we like to look into how to measure participatory governance and its impact on health systems performance. And before I like to kickstart the presentation, I like to acknowledge my colleagues with whom I've been working on this topic. You will hear from Pratik Gupta later during the course, and we also have Benjamin Rufili with us today to answer already some of your questions in the chat box. So let's start with the HSPA framework. And as a recap, the HSPA framework was developed by WHO and the European Observatory. And it's a conceptual framework that helps policymakers to assess performance more effectively in a holistic way. You can see here on your screen the high-level overview of the framework. And we used a functions approach because it was more apt to link it to the intermediate and final objectives. And we've placed the HSPA framework within this overall socioeconomic, political, and cultural context. And positive or good performance of the health system will ultimately contribute to societal goals such as economic development, social cohesion, and well-being. And you can also see here below the socioeconomic determinants of health will equally influence both functions and health systems goals. Now, looking closer into the HSPA, into the health systems, we see here on the left-hand side the 4 health systems functions. Now, governance is furthest to the left, and that's because we consider it as the most enabling function. And with research generation and financing, it clearly enables the performance of the service delivery function, which then has an influence on access and quality, and ultimately on final systems goals such as health improvement, people-centeredness, or equity. Now, we want to look into the governance function, more particularly into the stakeholder voice subfunctions. Now, let's zoom into the governance function. And here you can see the 4 subfunctions that we have identified. It's policy and vision, including multi-stakeholder collaboration. It's information and intelligence, not only collecting, but using and analyzing the data for informed decision-making processes, legislation and regulation. And today's focus of this webinar on stakeholder voice, very much looking at amplifying people's voices in health decision-making processes to ensure that those policies and strategies are more responsive to the needs of the population. Now, moving further to the right of the framework, here in this yellow area, you can see the assessment areas. So areas that we identified to examine the performance of the subfunction. Now, for stakeholder voice, we have identified 2 of them. The first one is whether national health policies, strategies, plans, guidelines, or laws are developed with the broad participation of key stakeholders. And key stakeholders can be, for example, different line ministries, academia, providers associations, but also civil society, lay people, and vulnerable population groups. The second assessment area is whether stakeholder participation is considered as a priority for the government, whether there is an enabling environment conducive to participation. Here, we really want to look into the investments that have been done in order to move away from those ad hoc engagement that we've seen a lot during the COVID-19 response to those more regular and sustained and meaningful engagement mechanisms. Now, however, across the different health systems performance assessment reports, we see that often data is limited in countries to assess the governance function, and in particular, the stakeholder voice subfunction. And this actually brings me to a literature review on social participation measures, which we have done recently. The paper is accepted and should be out soon, so please take note in the source below on your screen in order to have a look if you are interested. I must say that at the time, this work was not directly linked to the HSPA framework, but it certainly helps to shed more light into the different measurement options. And while the stakeholder voice function can be regarded as slightly broader, here the focus was really on the government engagement with the population, with communities, and with civil society, what we call social participation. And to make it clear upfront, we are still not yet there to present you a full list of validated indicators. That's the goal, but an inventory list is already a great starting point to better understand what is already out there in the literature. So the objective was here to do that rapid literature review of measures and then map those against the key themes that we have identified and put forward in the WHO handbook on social participation. Now, a couple of key findings. Since the year 2000, we have identified 48 studies. Out of those 48 studies, 8 studies particularly looked into national level processes, but the majority of studies had a focus on subnational level, in particular measuring participatory processes through a single process. Now, what we can see across the different studies is that social participation is being measured. However, it stays largely on the existence of participation rather than on the quality of participation. And I think that is also not very surprising to us, because measuring the quality of participation is complicated and gets fuzzy. And we will hear from our speakers later, from our country speakers later during this webinar, about the difficulties in doing this in practice. And linked to those measurement challenges, I must say, we also noticed that across the different countries, the policy use of those social participation data seems to be fairly low in order to then improve the participatory processes. Now, from those studies identified, we were able to identify a total of 172 measures. There is no golden standards, but good news is certainly that there's a general consensus. And this general consensus we were able to make because we were able to categorize all these 172 measures along the 5 themes of the Social Participation Handbook, which is, for example, representation, capacities, legal framework, policy uptake, and sustainability in the terms of sustaining engagement over time. And we will also be able to link it to the 27 concepts, which I will come in a moment. Now, across the different measures, we can see that most of the measures were around capacities, followed by representation and policy uptake, and the least actually were on legal framework and sustainability. Now, in the next 2 slides, I'd like to show you the different themes and the specific concepts which you can link to the assessment areas of the HSPA framework that I've just shown you before. And for the capacity theme, we have divided it into communication, recognition, and technical skills, both for government actors and the population. And that was also a framework that we've put forward in the WHO Handbook on Social Participation. So if we look closer on the communication skills, for example, it's the ability to listen, the ability to negotiate with civil society, but it's also on the existence, on the public awareness of the participatory spaces. Now, for recognition and technical skills, it's very much focused on the perceived perception of participation. So for government actors, for example, the perceived added value of participation or of facilitation and space design, which is very important in order to, first of all, acknowledge that power imbalances exist, but also how to mitigate those power imbalances among actors to ensure and create a safe space for everybody to meaningfully contribute. Now, for population groups, it might be also the perceived usefulness of participation or empowerment. Now, on this slide, you can see the concepts for the remaining 4 themes. Again, what I mentioned before, legal frameworks, rather a fewer measures. Again, very much on the existence, for example, the documented procedures and strategies for participation, participatory spaces delineated in laws, for example, laws on legal frameworks for participation. For policy uptake, we saw that 25 out of the 32 measures looked at the perceived impact on decision-making. For representation, I think also not very surprisingly, a lot on the diversity or the proportion of different stakeholders, so whether different stakeholder groups are represented in a participatory processes, but interesting also the attempts, for example, to measure the quality of representation or the clarity of roles. And lastly, on sustainability, a lot of the measures looking into the resources for participation, both in terms of human and financial resources, but also here on the sustained attendance, looking at the trajectory over time. Now here on this slide, I've picked a few measures to show you the variety of measures. So some measures were clearly quantitative in nature and are often considered, let's say, easier to get data on, looking at issues like the proportion of participants from specific stakeholder groups. So here in the example, for example, the average proportion of village development committee members who are women. Now, what we've also seen is that a large part of the quantitative measures were actually using Likert scales. And that first was a bit surprising because we actually saw that the ratio between quantitative and quality was even out. So we had 90 measures qualitative versus 82 measures quantitatively, but we can actually see that this high number of quantitative indicators can be largely explained by the fact that numerous authors used Likert scales to assign numeric values to these qualitative concepts. Then a third part is very much on the qualitative measures looking into the perception. So 95 out of the 172 measures were actually perception of different stakeholders regarding different aspects of a specific participatory space. So for example, here I've chosen a couple of one looking into empowerment. Do you think there is an opportunity for you at your level to get involved in health policy making, or the self-evaluation? I think, again, it looks very much into some of the subjectivity, right, in nature on being listened to, self-esteem, confidence, but also here on the quality. In one study, it was asked, how does a community perceive levels of diversity and addressing inequities? Now, since our webinar also looks into the linkages to performance, I've picked a couple of ones here that assessed or attempted to assess the policy uptake. Now, here you can see the documented impact on decision-making. For example, the percentage of programs endorsed by participatory spaces being implemented, or on the type of evidence. Are we only considering expert opinion, or are we also including patient inputs or inputs from the general or lay public? I think also interesting here on the link to downstream changes is the attempt to measure the chronological link between the community participation and the changes that have happened. And then, as I mentioned before, many of the measures, especially under the policy uptake, looked at the perceived impact of decision-making, whether people and participants felt that they actually had a possibility to meaningfully influence the decision that were made. So in conclusion, we saw that many of the measures across those studies very much look at the existence and not so much at the quality. The concepts that you see here can clearly be linked to the assessment areas to determine effectiveness of meaningful engagement. But again, a note of caution that all of these measures here were developed by authors for purposes of a specific study objective, with many looking at subnational processes, measuring it through a single participatory process. So as a next step, we would very much like to work with countries on a list of standardized indicators that could be used by policymakers to assess participatory processes at the national level in their respective countries. And this can then be a helpful starting point, which then further needs to be adapted, of course, to the specific country context and linked to both of the qualitative information that can be found in countries and, if available, locally available indicator data as well. Now, in my last slide, I'd like to just come back to the HSPA framework. We have seen that governance, or we consider that governance is an enabling function, and that's why it is also furthest to the left of the HSPA framework. That also means that the path actually between governance and final goals is very long, and a direct link is more difficult to make because there is so much happening in between. And that's why we sometimes say that it's easier to justify shorter pathways via the service delivery function in order to then influence the intermediate and final goals. And I think over the last years, we've seen an emerging evidence-based and measurement tools, both looking quantitatively and qualitatively. So if, for example, we have a social participation process in a country X, let's say, to develop a community engagement strategy, we very much hope that with that strategy in place, we can activate the service delivery function through community engagement initiatives, in particular focusing at the public health and the primary care level. In this country, there might also be other indicator available, such as patient-reported measures like PROMs or PREMs. There might be other indicators, disaggregated data by certain population groups, such as access or barriers to access or quality variations. And interestingly, the Quest Network had put forward recently a People's Voice survey, which looks at the perception of the population in terms of health systems performance, which then would fall more under the people-centeredness goal that we have put forward here. So in sum, what my point here is that sometimes it's easier to cut it down into different and smaller and plausible pathways in order to strengthen the evidence base and the storyline that it is very much needed that governments are engaging in a meaningful manner with population, civil society, and communities as a key function of the governance function. And we are well aware that that process will not be linear. It will be bumpy, but it helps then to trigger improved ownership in taking their decisions, the decision of their communities, ultimately helping to transform systems where people are really at the fore and the center. And with that, I thank you much for the attention, and I hand it back over to you, Deepa. Thank you.
Great, thanks, Kira, for highlighting a number of very important points, starting with the fact that governance and anything that happens in governance, governance is an enabling function. So that's why it's further at the very left of the framework. And so its influence over everything else that happens in the health system is obviously mostly indirect, because it's an influencing, enabling function, and especially trying to find that direct link between anything that happens in governance and final systems level goals is obviously a difficult one to make without analyzing what the smaller links in between, as Kira just really nicely explained to us. And I think we've also heard how we are at the early stages of understanding how best to measure participation, at least in a more common way, and that we are really looking at the moment quite rudimentarily more at the existence of participation rather than really assessing the quality of participation and how meaningful it is. So we'll hear more about how that plays out in practice in countries on our panel. But first, we'd like to hand back to Erica and see what the results of the poll was. Thanks. Go ahead, Erica.
So yes, very interesting results. The big focus in a lot of countries seems to be on improving access to care. But what's really interesting to me is that there's a really interesting spread when it comes to health system performance. The priorities are right across the board, and it's also quite heartening to see that none of the above was not applicable in any of the countries. So some very interesting results there. So thank you very much, everyone, for doing the poll. Deepa, back to you in the studio.
Thanks, Erica. Yeah, those are interesting results. We did the same poll on our first health systems performance webinar a couple of weeks ago, and we had similar results. There seems to be quite a good spread across the different performance dimensions. So we will now kick off our panel with our first speaker from France, Pascal Mélihan-Chenin, who is Secretary General of the National Health Conference in France, which is a public advisory body to the Ministry of Health. It sits within the Ministry of Health and has the explicit mandate of bringing in the voice of communities and civil societies into health policy makings. Its membership includes civil society organization, and he has been Secretary General since 2017. He's also associate professor at the Gustav Eiffel University, where he teaches public health and quality of care. And he knows the civil society world quite well, because it's where he started off his career before moving into government and ministerial work. So now we'll hear from Pascal on how can we measure and evaluate participation in France. I know it's messy. Give us some clarity. Go ahead, Pascal.
Thank you, Deepa. Hi, everybody. So first, the French National Health Conference is a consultative body. It was created by law in the mid-90s. And to maintain the independent and democratic nature of the assembly, first, we must secure the representativeness of the CNS. And this body includes 97 independent members from the widest range of stakeholders in health and social sectors at the national level, including patients' organizations, unions, researchers, healthcare services, health professionals, product providers, locally elected officials, and representatives of regional health consultative bodies, including those from the overseas. By enforcing a quorum for any deliberative meeting equal to 50% of the theoretical number of members, we make sure no decision is made by a minority. The decree ruling the CNS states which organizations appoint representatives and how as independently as possible from the government. Secondly, the members elect their chairman independently from any government or ministry influence, and it's quite rare in France. For instance, in 2011, government tried to favor a candidate which ended up losing the election anyhow. He was a professor of medicine, and he was and the chairman who was elected was a woman from a region and representing patients. The 17 members of the standing committee are also elected internally, proportionally to the importance of their sector within the assembly. They meet once a month, so more frequently than the whole assembly, and can therefore follow the advancement of reports and projects more closely. Thirdly, the Secretary General enforces a series of procedures that ensure a truly democratic deliberative process, even if they sometimes seem like heavy-duty operations. Let me say, for instance, before passing every resolution, the standing committee goes through it thoroughly, sometimes during hours, to make sure every member of the standing committee is okay with the wording. At last, the CNS organizes hearings to ensure that even the populations that are the furthest from the healthcare system and the deciders, their needs are taken into consideration, and any organization can be heard regardless of their significance in number or sector. The CNS is the only French institution, for instance, to invite for hearings the all 165 NGOs accredited by the Minister of Health. Some of them are patients organizations, but there are also organization of consumers or organization from in the field of poor people or disabled people. And for instance, last year, CNS shared the main draft recommendation of its project of report on health democracy in a webinar open to everyone willing to participate, even those who were not members of the CNS. And the audience had just to register and was free to react. A health democracy is a French term for social participation in health, I can say. And it's a result of a history of 20 years. In 2002, two important laws were adopted. Of course, evaluating CNS impact on health system performance is not easy at all. I share that. However, I will try to, with a recent example from the COVID crisis, the CNS passed a resolution in April 2020, calling upon the government to consult civil society and health democracy consultative bodies for the management of the pandemic. This resolution has been widely used, and other prominent institutions have also tried to promote health democracy or social participation. In June 2020, the government announced a reinforcement of the regional health agency supervisory boards. And a year later, in June 2021, several improvements were made through a decree. For instance, an accountability mechanism. The general director of the regional health agency must submit an annual report to the regional consultative bodies, summarizing the action taken on its resolutions. So maybe I will I will reply to questions for furthermore.
Thanks. Thank you, Pascal, for giving us a good overview of the CNS, the National Health Conference, or CNS in its French acronym. So if we understand correctly, some of the things that you might evaluate, or that can be evaluated, for example, is the fact that you have a quorum, that do you actually have enough civil society people voting in decisions within the CNS? This is something that again can be seen as a sort of indicator. And of course, impact on the performance dimension of equity is obviously a difficult direct link to make, but with that argument, you were able to pass this resolution during the COVID crisis that that the COVID-19 measures were not taking into consideration sufficiently the situation and and experiences of some of the vulnerable people in society, which is of course not unique to France, but we see, we saw that in many countries. We'll get back to some of those points in the discussion. I'd like to hand over now to our next speaker from Portugal. We're thrilled to have you here, Gonçalo Figueiredo Augusto from the National Health Council of Portugal. This is like the body in France, also a consultative body to the Ministry of Health with the explicit mandate of bringing in the voice of civil society and community groups into health policy making. It is a new body that was founded in 2017. Gonçalo is an expert advisor who works for the National Health Council. He's also a medical doctor and a public health specialist and a professor at the Nova University Lisbon, Nova National School of Public Health, and Nova Medical School. Gonçalo, can you hone in a little bit more on the aspect of evaluation of participation, on how the National Health Council has reflected on this? I realize it's a new, fairly new institution, and you may not have done, bigger and broader exercises, but there have been lots of reflections and discussions on this inside the council. Tell us more about that. Over to you.
Hello, Deepa. Hello, everyone. Yes, there was already some thinking about evaluating this new body, how the National Health Council has actually impacted on political decision, because it's its main mission to promote consensus, to promote participation in drawing decision-making in health in Portugal. And of course, we have already started thinking about that. The National Health Council has already issued some recommendations. We would think of assessing how these recommendations were taken into account by the Ministry of Health, and also to go a little bit further and find ways to promote more participation. Actually, now we have 30 members, president, vice president, and 28 other members, from 6 of them chosen by the Health Commission in the Parliament from patients' associations. And then we have representations from universities, municipalities, parishes, all autonomous regions, and so on. And of course, we would like this participation to be more active, more measurable as well, and also more broad. We have patients' associations. We would like to have a bit of national health users, health service users, with voice in the council, and maybe to replicate this idea of participation of the National Health Council locally. Of course, this is a huge challenge. There are some political measures that were taken in Portugal recently, namely the transference of competencies to municipalities, that could help to transform a bit this dynamic on the local level, to promote participation at the local level. But for the time being, we are a very recent body, although the National Health Council was foreseen in the law since 1990. It was only enacted in 2016 and effectively started working in 2017. So it's a very recent body, and we, for this first year, the National Health Council was mainly concentrated in promoting the public intervention through its members in the political decision. We have issued a few reports with recommendations from the Ministry of Health. The National Health Council was also very active during the pandemic, with opinions on the several measures that were taken by the government. And now we are approaching 7 years of existence, we would love to make a first assessment and maybe to transform the National Health Council in a more participatory platform. We just have to find a good way to do that, and also to replicate this model to other contexts.
Sorry, thank you so much, Gonzalo. That was a great overview of the short time that the National Health Council has been in existence, but you've already highlighted a number of very key points, such as measurement of policy uptake, which we saw was in the literature review, was also something that was a concern for many in terms of measuring participation. Also, representation, how to ensure through the evaluation and measuring participation that representation is broad and can be made as broad as possible, including also lay people, as you are trying to do in Portugal. And these are all issues that also came up in the indicator overview as well. And of course, what is a little bit harder to do is linking this to performance dimensions. And I think the easiest link is probably equity. Although there's not so much literature out there, but I think the more we measure participation, the more we can try to link it to what's happening in different socioeconomic groups. So thanks so much for that. I will hand over to our next speaker now, Pratik Gupta, who is a monitoring and evaluation expert from the London School of Hygiene and Tropical Medicine, where he's currently a doctoral student. Before that, he spent many years in Indonesia, Cambodia, and as a global independent consultant, working on indicators and measuring different aspects of health outcomes. We'd like to hear from you, Pratik. What do you make of all of this? Governance is difficult to measure; it's complex to measure. We heard from our country examples that in practice, we're still at a very early stage of looking at sort of the existence rather really than the quality of participation. Is it feasible to measure governance, and is it feasible to link governance to performance? Over to you.
I'm just going to highlight a few things that were said in some previous presentations that I think that were said really well. I think Kira, in her presentation, she shared some frameworks from the Health Systems Performance Assessment Manual, and you always look at those frameworks with those arrows and the dotted lines and everything, and it implies a linearity, which I think there's 97 people or 90 plus people in this call. I think in each of your countries, that it's not linear. It goes from one direction, it comes back. It goes here, there. There's many more people that are involved. So I think that that's something that we want to understand. And I think that the applicability of any of these measures are going to be really important to adapt to a specific country context and even, perhaps a subnational country context. So we would have to have an understanding of a theory of change, perhaps, or some kind of conceptual framework that would be very specific to that country. And I mean, I think that, the Health Systems Performance Assessment Manual, those frameworks are useful, but, at a more macro level. And so I think that would be one thing that's important. One of the things that, we talk about in the paper is that, okay, we identified 172 measures from 48 studies that fit, these 5 themes from the Handbook of Social Participation that I think you've seen the link to, and the 27 concepts that are associated with these 5 themes. We are not implying that all of these measures would be useful in all contexts. The hope is that, once these are adapted to your country context, you can pick and choose and identify which specific concepts are useful for you in your country context. And then you can kind of see that, okay, well, maybe this might be important here, this might not be important here, to understand specifically that stakeholder subfunction of governance that's associated. And so I think that that's something that's important. It would take a little bit of thinking, but I think that it could provide useful information. But I think that gets to the second question. That's talking about the supply of information. but I'm a little bit less clear on the demand of information. And what I mean by that is that the decision-making process, the key stakeholders that can make changes or adapt to their circumstance, how are they going to use this information? What information do they want to use? And in what format does it need to come in? And so I think that some of those thinkings need to happen so that this information can be efficiently collected and sent to the right people who can then process the information and use it for decision-making purposes or adaptation purposes, so on. So I think that that's something that would be really important. I think one of the really important things is that, okay, social participation, as has been described, is very, very important as an end to itself, but we would like to see its impacts on the intermediate objectives and final goals as they're sort of listed out in that health systems performance assessment framework. And I think that, from the review, there aren't as many studies that sort of very specifically linked the changes that were happening at social participation to these downstream effects like equity, like increased access. As Deepa said, that's quite hard, but it can be done. And I think that part of it is that having a clear understanding of how governance sort of more broadly can link to those downstream aspects, or government actions that can lead to those downstream aspects, and how stakeholder voice specifically can help with that. I think that would be important to understand sort of before designing some kind of evaluative framework. And then also it's identifying a core set of measures which could potentially come from the 172 that we identified in our paper for stakeholder voice, and then trying to sort of figure out, okay, what kind of investment do you want to make in a research methodology to collect these downstream effects on the intermediate goals and the final objectives. And then, it's not just sort of doing one thing here and then having something done at, let's say, health equity. It's being able to understand how the links come all the way through. And that might require quite a bit in terms of, studying multiple parts of the system, using different tools, using quantitative and qualitative methodology. Mixed method studies might be useful. And then you would need to then think through, okay, well, what is the level of evidence that would be most important that we could use to demonstrate, some kind of change that would be then useful going forward. I think that, a lot of times, a lot of people sort of look at cluster randomized trials. Obviously, that's a gold standard of evidence, but it's going to require a significant amount of work to have formative research and to be very clear about what the effects are of social participation or governance on these downstream effects, these intermediate objectives and final goals. But I think that you can do very rigorous qualitative studies or even some quantitative studies that can measure parts of the process all the way through, and that might give you an understanding. And I realize I've talked for quite a bit, so I want to pause because certainly I would really love to hear from as many people in the audience. What are the challenges? I mean, what are the things that you're thinking? How would this make sense in your context? Because I think that that's where this becomes very interesting to see, like how this could potentially be applicable, and what sorts of information, what other kinds of information do you think you would need? And then also so that we can learn from these examples, because I think that, as Deepa was mentioning, it's an area that requires a little bit more research, but we're really excited. And so again, thank you. I realize I probably talked very quickly, but I just wanted to pause there and hand it back over to you, Deepa. Thank you so much.
Thank you so much, Pratik. And I think you've highlighted a major point, and this is really a take-home message we'd like to give all of you in our audience, is that again, and we've mentioned it before, many speakers have mentioned it, the link between governance and intermediate objectives such as access and quality, or final goals such as overall health improvement, system level equity, efficiency, responsiveness, people-centeredness, etc., is not an easy link to make, because one is and governance is enabling, and there's lots of things that happen before those outcomes occur. And so it's often better to, or what you need to do is think through the chain of events, or the results chain between governance and those goals. Where does it go through? What if we improve participation, for example, community participation, can we make health services more responsive? That's within the service delivery function. And then through that, do we improve access and quality of care? And through that, do we improve overall health outcomes and responsiveness? So, and for each link, we might have some good evidence, which then helps us put together the full narrative. Because in order to really make a direct link between governance and health outcomes, you would need some very fancy, randomized control trials done in the field, so real implementation studies, which are hard to do and get ethical approval for. So with that, we'd like to see what the chat box has come up with. Erica, over to you. What are some of the questions, comments?
Lots of questions, lots of comments, very lively chat box. Thank you, everyone. Please do keep putting your comments and points in. But some sort of more subtle questions for clarification. And someone asked is whether participatory governance is the same as participatory democracy. And where would you draw the line between the two, if indeed there is a need to draw a line? There's also been quite a lot of discussion around COVID-19 and how disruptive it's been. And did it actually push forward or did it hinder participatory governance in health systems? And that given that, third question, given that that patient feedback is widely used for assessing quality of care, is there scope for developing these communication channels for engaging users in decision making and sort of linking it all together, linking it up to sort of like quality of care? And small question, do we know of any examples of participatory governance used in cancer screening? So thank you very much. Keep your questions coming in. Maybe we'll be able to get in a second round. Thank you.
Okay. Let's see, which one shall we start with the, we'll start with the more difficult questions, semantics. Participatory governance and participatory democracy. I have a view on that, but I'd like to give the chance to the panel. Would anyone like to take that question? Perhaps Pascal, as in France you use the term health democracy. Any thoughts?
Okay, you listen to me, okay. In France, in health democracy, there are two elements. On one hand, you have all the rights of the patients, individual and collective rights, including the accreditation of the NGOs, for instance. And all of that was really created in 2002. And in the context of the HIV epidemic, notably. And the other element is the civil society forums like the CNS, for instance. But regarding the COVID crisis, it's I would like to quote quite an old CNS resolution, which was adopted in 2010. And you know that in 2010, we were in the period of the H1N1 influenza pandemic. And it's quite interesting to cast a glimpse at this period of time. And just a sentence, the management of the H1N1 influenza pandemic in 2009-2010 and the resulting evaluations have revealed a lack of sufficient consultation with the various stakeholders in this health response mechanism. So I don't know if I really answered to your question, but I wanted to quote that because you know that what we have we came through the COVID crisis. It was also the same issue slightly in those times. So it's not really new. So if I have time, I just would like to share what I tried to do with an institutionalized participatory mechanism regarding the question of the follow-up of the resolutions. It's quite an important question because it's a question of are what we are doing useful or not. And under the decree ruling the CNS, it's mandatory to organize each year a hearing of the Ministers of Health and Social Affairs by the CNS as follow-up of the resolutions. And for instance, we should invite representatives from the ministers to present how they implemented them or follow the CNS recommendations. And but we did it only one time. It has only been done once since I took the job. It was in July 2017, and the only time in the history of the CNS even. In fact, the year before, in 2016, the Minister of Health asked the CNS for its opinion on a series of about 17 draft decrees implementing the January 2016 Health Act. And they were about hospitals committees where patients are represented, a Nutri-Score, the creation of the governmental agency, Public Health France, etc. But what is quite interesting is a year later, the CNS then auditioned the ministers to check on the advancement of implementing the policies and the decrees, in fact. But in reality, it was very time-consuming, and we weren't able to maintain the members' involvement. And so in terms of participation, it was not so, I was not so delightful of this attempt for such a follow-up.
Okay, so this is, I mean, you've highlighted the importance of evaluating, of measuring policy uptake and follow-up of these resolution follow-up of the results that come out of these participatory processes. There was a question we'll come back to, if we have time, to the question of the wording of democracy versus governance, but I'd like to let the other panelists speak as well. There was a question on measuring user satisfaction, patient perceptions of quality of care within the quality of care paradigm, and how this can be used in service of assessing performance of the health system. Anyone would like to take that question? Pratik, have you been looking at that? Gonzalo, I see you've unmuted.
Just a quick note on that, on democracy and governance. Quick note on that. In Portugal, the National Health Council is mostly an advisory body. So there are another institution, that's the Health Regulatory Agency, that takes care of the complaints, and even the Directorate General of Health conducts from time to time some inquiries on the patient satisfaction with the health system, so on. What I'd like to say about democracy is that, of course, not all participation should be enclosed in the National Health Council. The other bodies of the Ministry of Health, such as the Directorate General of Health, for example, the Directorate General of Health issues norms, regulations, and many of those norms and regulations technical, but they sometimes need to be discussed with partners, civil society, patients associations. If I'm doing a norm for diabetes, for example, it's not only nice but wise to discuss that with patients associations. But that culture is only now starting to be developed in Portugal, because one of the biggest complaints from patients associations and mostly civil societies that the technical stuff was not discussed, was not debated with them, that were the targets of those regulations. So this culture is very slow to develop, but I think we are on the way to do that.
So the way we govern, if it's participatory, that's more the participatory governance, and democracy is much broader. It's a political way a country works, for example, which should also be participatory as well. So they're interlinked terms. On the question of measuring quality of care, we have just a few minutes left. Pratik, would you like to take that? Go ahead.
So if as it relates to that question about patients' experiences with health facilities, so one of the things is that for our review, we did set a boundary in the sense that it was people, the population, largely interacting with policymakers. So it was sort of that part of the governance triangle, if for those of you that are familiar with it. And while we didn't exclude providers, if they were there, we included measurements on that sense, but it was very much about the population and the policymakers. And there is a measure that says, what is the population's perception of the quality of that space where they can make their voices heard. And if that's a place where they talk about, their experiences with health facilities, I think that that's an opportunity. I believe it was a qualitative measure. And so I think that you can see where if there is a regular forum for people to share their positive or negative experiences with the health facilities, and then asking them, okay, well, how did you feel about that that space for you, then I think that there's an opportunity. But specifically as such, I don't recall we didn't have a measure that specifically said, okay, that these patient experiences at the health facility level were specifically used, for formulation of some kind of policy. That level of specificity wasn't there. But I think, again, as we were talking about, these measures, as Kira mentioned, they were designed for that study's purpose, but I think that through an adaptation process, it might be able to find information that could be useful at your context and saying, okay, well, this is something that would be important for us to know. I hope that answers the question, and I'll pause there. Over.
Okay, so I think this highlights the issue of, the study, the participation indicators looked at participation from the governance function perspective. So it was about how far are people's voice being heard in the governance of the health system overall. So that's one aspect of participation. It's closely linked to participation at the level of service delivery. So participation, for example, at the local levels, at health district levels, regional levels, where for example, community groups or civil society is brought in locally in order to specifically talk about service delivery issues through a health committee, for example, and then feed into improvements of service delivery locally. And that the two are closely linked, because a participatory system obviously is one that would take some of those insights that's going on at the community level and aggregate it up and use it to also bring in those voices at the national level into policy making. And that's how we can then impact on performance, because the more we do that, especially at national and at local level, we can then improve quality of care, improve access, which then hopefully impacts further down the line on health improvement and responsiveness. So we are at the hour, so I will have to end here. I hope you have some insight into participatory governance and health systems performance. I'd like to just say for a second that we have another third webinar in the health systems performance assessment webinar series. In a couple of weeks, we'll be looking at pandemic preparedness and how performance assessment can support it. Thank you very much. Goodbye.